We'll now move on to the taping techniques. Before we do any taping, we would have also have done some functional tests. We could do a squat, a jump, or other tests that would provoke the pain. The outcome of this tape is that we should decrease the pain in the knee with at least 50% to have a successful tape. The patella taping, when applied, always uses a flexible adhesive mesh. In the cases where we tape the patella, it most commonly stays on the leg for an extended period of time. And this flexible adhesive mesh is hypoallergenic, and the tape can, in some cases, stay on for up to 72 hours. The tape will be applied from just lateral to the lateral border of the patella and will come across the medial aspect, around the corner of the knee, and just up to the semitendinosus tendon, not across it, not to cause any frictions. The position of it in a superior-inferior aspect depends somewhat on our assessment. If we found that our subject has an anteriorly tilted patella, the tape will go slightly above the superior patella border to press down and tilt the inferior patella pole out of the tendon and fat pad. So I'll demonstrate that. Laterally, just above the suprapatellar border, across the corner medially. Okay. This is our superior patellar border, our lateral patellar border, and our medial patellar border. If on my finding I find assessing a medial lateral tilt when I glide the patella medially, if the patella slides up and scoops up medially, the tape I would start with is the medial patellar tilt. Because if I do a medial patellar glide to start with, I have already increased the lateral tilt of the patella. So, in this case, I assume he has a dynamic or static lateral patellar tilt. I start my tape just lateral to the center of the patella, not as far as the lateral border. This is the tilt I'm addressing. I'm attempting to apply a medial tilting force on the patella by manually causing a little tilting force. So I'm pressing on the medial aspect of the patella, taking up the slack of the soft tissues, and applying a little bit of tension on the zinc oxide tape. What I like to see is a little bit of these characteristic wrinkling of the adhesive mesh. This tape is slightly above the patella on the medial aspect of the patella, and therefore will cause a slight medial tilting force. I will then go on to address the lateral medial gliding component. I found that the patella was sitting somewhat laterally, so I attach the tape just lateral to the lateral patellar border, go straight across the medial aspect of the tilt tape, and again with this one, in some cases I can push the patella or just apply a slight tension on the patella medially and downward while I'm again taking up the slack of the tissues. Here I have with two tape strips addressed three components: the medial tilt with the first tape, the lateral medial glide with the second tape, plus, because the tape is somewhat on the superior aspect of it, I have tilted the patella superiorly. If I have addressed, those are the three most common components that we would see when we assess patellofemoral pain. If I have addressed all three of those, and I want to recheck my comparable signs in function, for example, squat and jump, and before they get off the table, to do their comparable signs and their functional testing, I put my hand on the tape to keep it down so it doesn't pop up, and we flex the knee and straighten. And that just gives a little bit of flexibility and stretch and adhesiveness to it. And then we go on and retest the comparable signs, and we'll see, have we decreased the pain with at least 50%? And if we have, we can, using this tape, go back to rehabilitation, to training, and even participation in sport with much less pain than before. So this will allow us maybe to return to sport. If we still don't have a reduction enough of pain, we can then go in to look at the rotational component. If there's a rotational component, we can then go in and address that with a rotational tape. I mentioned this last because I find these are somewhat difficult to keep in place. We catch the lower inferior corner of the patella, and here we have a patella that we imagine is sitting in this orientation. I'm going to try to put a rotating force towards the center. So it's aiming somewhat downward and laterally. I can rotate the patella towards the central position and apply the tape upwards. Okay. And that is a rotational tape.